Why does San Francisco, a symbol of prosperity and innovation, allow thousands to sleep on its streets beneath gleaming skyscrapers? This chilling contradiction grips the Golden City, where visions of progress collide with the stark presence of tent cities and overlooked lives.
It sucks. It sucks to not have a place to belong. It sucks to not have your city that you love want to take care of you.
The homeless crisis in America is on full display here, a powerful reminder of systemic breakdowns demanding our focus. In this exploration, we'll uncover the unfiltered truths of homelessness, the deadly hold of fentanyl, its entrenched roots, governmental actions, lived experiences, and how San Francisco compares with other urban centers. This is a narrative of hardship endurance and an urgent demand for transformation. The current state of homelessness in San Francisco. On January 30th, 2024, San Francisco recorded 323 individuals experiencing homelessness, representing a 7% uptick from the 2022 point-in-time count. While this reflects a modest increase, it remains deeply troubling for a city celebrated for its prosperity and innovation. Alarmingly, 73% of this population is unsheltered, surviving without formal shelter, and exposed to unforgiving weather and urban dangers. The Tenderloin Mission and Bayview districts are among the hardest hit by this escalating emergency. In Tenderloin, for instance, sidewalks are crowded with tents, many surrounded by scattered trash and discarded syringes. The atmosphere carries a heavy sense of despair as people cluster together for warmth, their possessions crammed into tattered bags. This visible homelessness is not merely unpleasant to witness, but a stark symbol of the city's inability to support its most vulnerable residents.
Most homeless people, I'd say the majority, at least in the loin, are drug addicted or mentally ill, or both, usually both. But the drug addicted, it's different with every drug, but like you would never leave an item with a heroin addict because they get sick every day and they'll sell whatever they have to get.
Families are also increasingly caught up in this crisis, with the national rate of homeless families climbing by 33%. Many of these households end up living in RVs parked in outer neighborhoods, reflecting a growing shortage of affordable housing. Although the total number of homeless individuals has declined, the landscape itself is shifting. More families, veterans, and young people are falling into homelessness, often pushed by financial instability or personal hardships. The question remains, how can a city so abundant in resources permit such suffering to persist in plain sight? The answer lies not solely in statistics, but in the lived realities of those enduring daily struggles to survive on the streets. How do we as a collective move past mere data to build meaningful solutions for those who need them most? The fentanyl crisis, a deadly complication. San Francisco's homelessness crisis is closely bound to the escalating fentanyl epidemic, a synthetic opioid that has ravaged neighborhoods throughout the city. Fentanyl is 50 to 100 times stronger than heroin, making it a lethal agent that has transformed areas like Tenderloin into centers of addiction, hopelessness, and death. In recent years, fentanyl has become the leading cause of hundreds of overdose fatalities annually, a grim trend that continues to worsen. The drug's affordability and widespread access make it particularly appealing to those already on society's margins, especially the homeless, who often use substances to cope with their trauma.
Nobody wants to be an addict. Nobody wants to live like an addict. I'm still an addict because I don't really know how to stop. You know, I try, but it's just I can't.
Fentanyl's effect on the homeless population is devastating. Many already struggling with financial instability and housing loss turn to the drug sinking deeper into addiction and losing jobs, personal ties, and any sense of security. This dependency not only intensifies their hardships, but also drives minor crimes such as theft to sustain their usage. The surge in overdoses and unpredictable behavior has triggered mounting public safety worries, straining hospitals and emergency responders. In 2024, emergency departments experienced a dramatic rise in overdose-related cases, adding further pressure to an already stretched healthcare network. To counter this, harm reduction strategies have been implemented, including distributing sterile syringes and naloxone, a medication that reverses overdoses. Though these programs have saved countless lives, they have ignited fierce controversy. Opponents claim harm reduction may unintentionally perpetuate addiction, while proponents maintain these tools are vital lifelines for people in crisis. The fentanyl epidemic poses a critical question. Can harm reduction by itself break the vicious link between addiction and homelessness, or does it simply postpone the outcome? For many living on the streets, addiction acts as both a driver and a result of their homelessness, forming a relentless cycle that cannot be shattered without a holistic response. San Francisco's battle with fentanyl underscores the urgent demand for solutions that confront both substance dependency and the housing instability at the core of the problem. Root causes of homelessness in San Francisco. San Francisco's homelessness crisis stems from a mix of economic, social, and structural forces that have left thousands struggling to survive. At the center lies the city's sky-high cost of living, particularly its unaffordable housing market. From 2021 to 2024, average rent climbed by 20%, while wages for low and middle income earners barely moved. A one-bedroom apartment now costs over $3,500 monthly, a figure far beyond the reach of many. The tech surge, while boosting economic growth, has driven up property values, displacing working-class residents and accelerating gentrification. As high-income tech workers flood the market, affordable housing becomes scarce, pushing individuals and families into homelessness. This surge in living expenses is worsened by stark economic inequality. San Francisco ranks among the nation's most unequal cities, where tech workers earning six-figure incomes live beside service employees and teachers struggling to get by. For many, one crisis, be it medical debt, unemployment, or a rent hike, can trigger homelessness. This sharp divide reflects the broader challenge of homeless in America, where prosperity fails to reach those at the margins. Mental health and addiction compound the crisis further. A significant share of San Francisco's homeless population suffers from untreated mental illnesses or substance dependencies worsened by fentanyl spread. The city's mental health system remains underfunded, leading to long wait times and inadequate treatment options. Without proper care, many are trapped in cycles of chronic homelessness with no path to stability. Systemic racism is another key driver. Though black residents make up only 6% of the city's population, they account for nearly 40% of the homeless. This disproportionate impact is the result of decades of exclusionary housing policies and economic discrimination. These entrenched racial and economic inequities continue to marginalize communities, feeding the expanding homelessness crisis. On top of this, natural disasters like California's recurring wildfires and the lasting fallout of the COVID-19 pandemic, job losses, evictions, and weakened social programs have intensified the strain on the system. Combine these root factors, skyrocketing housing costs, inequality, mental health struggles, addiction, and systemic racism create a tangled crisis that requires sweeping solutions. How can a city of extraordinary wealth allow so many of its people to slip through the cracks? It's a question that must be answered if homelessness is ever to end. Government response and policy efforts. San Francisco's response to its homelessness crisis has combined ambitious initiatives, public frustration, and gradual progress, underscoring the challenges of tackling homelessness in America. Over time, the city has introduced numerous policies, though their real impact remains heavily debated. Under former Mayor London Breed, the city unveiled an ambitious 2020 strategy to make homelessness rare, brief, and non-recurring. This plan led to the development of more than 3,000 housing units and nearly 2,500 shelter beds from 2020 to 2022, surpassing early expectations. The Department of Homelessness and Supportive Housing, HSH, founded in 2016, has been central in organizing shelters, food employment training, and supportive programs. Yet despite these efforts, homelessness endures, sparking concerns about the lasting viability and real effectiveness of such measures. In 2025, newly elected Mayor Daniel Lurie rolled out the Break the Cycle initiative, a more precise strategy targeting visible encampments and aiding vulnerable communities. The plan dedicated $13 million to relocation assistance, RV buyback initiatives, and services for families living in vehicles. Further ordinances passed in July 2025 restricted RV parking to reclaim public spaces while providing alternate housing opportunities. These efforts aim to blend empathy with enforcement, but they have stirred heated debate. Some residents applaud the removal of encampments, while others contend these actions simply relocate people without tackling underlying causes. The key question persists: can clearing public spaces truly end homelessness, or does it just move the problem around?
Right now, it's crowded over here.
At the state level, California has pledged billions to address homelessness, prioritizing affordable housing and mental health programs. Still, delays within state bureaucracy and weak interagency coordination have stalled meaningful advancement. On the federal side, the Department of Housing and Urban Development, HUD, advocates evidence-based strategies like prevention and rapid rehousing, which San Francisco has partially adopted. Nevertheless, progress has been sluggish. Harm reduction measures, including naloxone distribution to reverse overdoses, have preserved lives, but face criticism for not confronting core addiction issues. Despite allocating $1.3 billion annually to homelessness services, the city's lack of accountability and concrete metrics has raised doubts about the effectiveness of its strategy. Though significant steps have been taken, the gulf between lofty objectives and real outcomes emphasizes the need for more unified and forward-thinking solutions. The voices of the homeless in San Francisco. To truly grasp San Francisco's homelessness crisis, we must listen to the people living it every single day. Their testimonies reveal an unfiltered window into the human toll of this unfolding crisis. Consider Aaron Reed, a 40-year-old Amazon warehouse employee who, despite clocking 50 hours weekly, lives in a van with his mother and their dog. "I'm not lazy," Aaron insisted. "I work hard, but rent is impossible. One bad day and you're out here." Aaron's situation is far from exceptional. Countless unhoused residents in San Francisco once had steady jobs, but rising rents, medical emergencies, or personal struggles pushed them into homelessness. Their stories lay bare a system that fails to support people before they slip through society's safety nets. For those surviving outdoors, the daily fight extends beyond securing shelter. It's also about preserving dignity. Basic necessities like clean bathrooms, safe places to sleep, and mental health services remain scarce. Many, particularly those hooked on drugs like fentanyl, describe feeling ensnared in an inescapable loop. "No one chooses this life," says Maria, a 52-year-old woman from the Mission District. "You end up here and it's like the world forgets you."
It's about 3 of them.
Maria's voice echoes a widespread feeling among the homeless, a sense of abandonment and skepticism toward government programs that often appear out of touch with their reality. Amid these hardships, resilience still emerges. Some participate in job training or volunteer at local centers, working to rebuild their futures. Others establish close-knit encampment communities, providing mutual care and solidarity. Yet they face constant barriers, stigma, unaffordable housing, and insufficient mental health resources. The lingering question is, why aren't the voices of homeless individuals more influential in shaping policies intended to support them? Far too often, programs are designed without meaningful input from those directly affected, resulting in initiatives that fall short. As we contemplate these narratives, think about this. How can we develop policies that truly meet the needs of the homeless in America if we fail to listen to the very people whose lives they aim to transform? Comparing San Francisco to other major cities. San Francisco's homelessness crisis, though severe, reflects challenges faced by many major U.S. cities, all confronting the same overarching issue, but differing in strategies and outcomes. When set against other metropolitan areas, the disparities in scale and policy responses are striking, offering clear insights into effective and ineffective approaches. New York City, for instance, has a homeless population exceeding 80,000, far outpacing San Francisco's numbers. Yet only around 3% of New York's homeless remain unsheltered, compared to a staggering 73% in San Francisco. This significant difference stems from New York's more extensive shelter network and public housing initiatives, which, despite their imperfections, provide essential support for many. By contrast, San Francisco lacks a similarly robust system, leaving much of its homeless population in tents or improvised shelters. Although both cities struggle with housing affordability, New York's commitment to preserving public housing, while not
that's
flawless,
a
offers
very
a
nice
safety net that
bracelet.
San Francisco sorely misses.
Green Bay.
Los Angeles, another large West Coast hub, faces a crisis similar to San Francisco's invisible homelessness, with about 75,000 people unhoused. Like San Francisco, Los Angeles
giving
is
away
contending
food
with
over here.
soaring housing prices and a destructive fentanyl epidemic.
Gotta need some dog food.
However, Los Angeles has pursued a more innovative path, embracing solutions like modular housing, tiny
All
home
these dudes use.
These initiatives, though still developing, have demonstrated potential in delivering rapid, scalable shelter alternatives. San Francisco, in contrast, often appears mired in red tape with expensive, slow-moving projects that fail to offer immediate impact.
This is.
Both cities also
Around
depend
3
heavily on
years.
harm reduction measures, such as distributing naloxone to reverse overdoses. But debate lingers over whether these efforts tackle core issues or simply provide temporary relief.
Yeah. Okay.
Seattle. Another West Coast city has advanced its housing-first approach, prioritizing permanent housing without prerequisites. This strategy has seen moderate success, cutting chronic homelessness by 20% in select regions. While San Francisco has incorporated aspects of this model, it has not scaled them sufficiently to match Seattle's progress. What sets San Francisco apart is the glaring divide between its thriving tech-fueled economy and the deep poverty endured by its homeless population. This juxtaposition intensifies the crisis, as immense tech wealth often sits side by side with visible human suffering. As cities nationwide continue to confront homelessness, it's evident that no single solution can fit every context. However, exchanging proven methods through rapid rehousing programs, integrated mental health care, or creative housing models can help cities like San Francisco, New York, Los Angeles, and Seattle
This is the nigga
address a
doing all the
problem
drugs.
that reaches beyond local borders. The question persists. How can cities draw from one another's victories and missteps to build enduring solutions to homelessness? Conclusion. San Francisco's homelessness crisis mirrors a larger national challenge tied to principles of economic equity, compassion, and justice. The mix of unaffordable housing, social inequality, fentanyl addiction, and systemic breakdowns has produced a daily humanitarian crisis. Although some progress has occurred, government initiatives alone fall short of delivering the sweeping change required. The voices of unhoused individuals remind us that solutions must center on human dignity. San Francisco's situation serves as both a rallying cry and an urgent reminder to meet the needs of society's most vulnerable. To truly end homelessness in America, bold collective action is essential. For additional perspectives on this topic, be sure to explore our other videos and share your thoughts in the discussion.
The soup right here.